Here is an overview of a total hip arthroplasty. We begin in the operating room with the Hansen table, which is a special operating room table designed for direct anterior hip replacement surgery. This bed ensures proper patient positioning and independent control of each leg to allow for safe and precise surgery. On the surgical back table, we have all the necessary sterile tools, drapes, and equipment for the total hip replacement procedure. Once the patient is asleep and positioned on the Hansen table, we take x-rays of the pelvis and of each hip. We then use these intraoperative images to help guide our surgical templating and planning, helping us to configure the exact placement of the final implants for an optimal outcome. As surgery starts through the direct anterior approach, we use specialized instruments to carefully dissect through the tissues to protect the surrounding muscles, which promotes a faster recovery. We coagulate blood vessels with electrocautery tools to minimize blood loss during the surgery. We make an incision into the capsule of the hip. This allows us to enter the joint space and begin working directly on the bone. Once we are into the hip joint, we place a stitch in the hip capsule to help further expose the surgical area. This also helps to protect the muscles from injury. Using a surgical saw, we cut the femoral neck and remove the femoral head. Using the x-rays taken during surgery, we know precisely where to make this cut. We use a powered corkscrew attachment to remove the femoral head in one piece. Here's the femoral head that has just been removed, clearly showing the rough and worn surfaces caused by arthritis. Once the femoral head is removed, we use a scalpel to remove excess tissue and to remove the labrum of the hip to clear the space for the implants within the hip socket. Now, with updated images showing the removal of the femoral head, we proceed with the next step of surgery. Using a reaming device, we carefully reshape the hip socket. We sequentially size up these bone graters until we have cleared away the arthritic bone and cartilage. The purpose is to create a perfect hemisphere shape that will receive the actual hip socket implant. As the reaming of the hip socket progresses, we can visually see on the X-ray monitor and physically feel with the graters that we have achieved the appropriate sizing for the patient's implant. The acetabular component, along with its corresponding liner, is inserted and secured, creating a smooth, durable socket for the new joint. The cartilage replacement implant or liner is inserted directly into the metal socket implant. We use a robotic mallet to secure the liner in place. We clear away bone at the top of the femur to prepare the bone for a process called broaching. We then use an instrument called a canal finder to help prepare a path in the marrow space of the bone. To broach the femur, we use sequentially increasing trial implants to find the perfect fit for the femoral canal. We use a milling device to ensure the top of the femur is completely flat and congruent with the top of the femur implant. Once we feel we have the appropriate fit of the trial femur implant component, we use a trial femoral neck and head to complete the temporary mechanical joint. During the broaching process of the femur, the hip joint has been dislocated. With the trial head and neck in place, we can now reduce the hip back into the socket and obtain x-rays to get an accurate assessment of leg length and joint stability. X-ray images verify the trial components are correctly positioned, ensuring the hip stability before proceeding. With the proper fit confirmed, we remove the trial components and implant the final femoral stem and head, completing the new artificial hip joint. With the final implants in place, we get one final X-ray as we conclude this phase of surgery. After the total hip components are implanted, the surgery concludes with the closing of all the tissue layers from deep to superficial with various types of suture material. We use a strong dissolvable suture to close the capsule of the hip joint. We then use a longer running stitch to close down the deep fascial layers of muscle. As we progress with the closure of tissue from deep to superficial, we use an additional dissolvable suture to bring together the subcutaneous layers. The incision closure process is very meticulous, as we want to decrease any risk of infection following surgery. On the most superficial skin layer, we use a stitch that is clear, almost like fish line. This approximates the skin edges so that the incision heals nicely. Finally, a mesh glue bandage is applied to protect the incision. This bandage is waterproof and helps the incision heal without complication. As we review the radiographic images of a total hip arthroplasty, we appreciate the surgical process to restore mobility and relieve pain, helping patients return to an active life.